We are really excited today to welcome Barbara Kornblau, who is an attorney and occupational therapist. She currently works remotely as a program director of Idaho State University in the occupational therapy program and lives in the Washington, D.C. metro area. She is a past Robert Wood Johnson Health Policy Fellow in the offices of Senator Harkin and Rockefeller, right before the Affordable Care Act passed and the reauthorization of the Americans with Disabilities Act. So we're really excited to have her here today, very timely with the upcoming election. And we're excited to hear a little bit more about her leadership on the disability section and her involvement with the Affordable Care Act and other related policies. So welcome, Barbara.
Well, thank you. I'm glad to be here today. Some exciting topics, especially with what's going on in politics in today's world.
Absolutely. Yes, we're really happy to have you here with this timing. So can you start us off by telling us a little bit about what prompted you to get involved as a leader of the disability section, or if it was this big at the time, and what your role was? I know prior to starting this, you and I were talking separately about how we are both occupational therapists and how there's sort of little involvement from OTs in the section, unfortunately, at this time. So I'd love to hear more about kind of what brought you to the
Sure.
section.
Sure. Well, I've always been interested in public health, and I have to be honest. When I was an undergraduate in occupational therapy school, it was undergraduate at the time, I had to get a certain GPA and a certain science GPA. And I would take a class, and the pre-med students would get a B and they drop it. I'd get a B and I was very happy. And then my grades would go down because they all dropped the courses. So I discovered that if I took history of public health, it counted as a biological science. And I was fascinated by it. I loved it. I became very close with the professor. I babysat for her kids. I used to do my occupational therapy arts and crafts in her class. She would tease me and then hang it on the wall in her house. I'm still very close with her, and she's like my second set of parents. I loved public health. I loved it. It was fascinating. I studied every epidemic. I mean, now it's driving me crazy because I feel like I know too much and I can't sleep because I know what they're supposed to do and they're not doing it. But it was fascinating to me. And so instead of going to graduate school in occupational therapy, I took all the public health classes and decided that it was a lot of law. So I was going to go to law school. And at the time, it was before the ADA, but I was always interested in disability rights. And I remember one time I said to one of my professors, why are you teaching, why are we learning, it was a long time ago, why are we learning how to use telephones for, how to help people with disabilities use telephones when they can't get into a phone booth because it's not accessible. In the old days, you had to get into a phone booth. So she finally said to me, look, go to the state capitol building and go see Representative Jim Wehner. He wrote the first curb cut bill in the country. Tell him you want to do volunteer work for him and go do volunteer work for him. So I did. So I learned a lot about policy stuff for people with disabilities. And he eventually gave me a scholarship that gave me in-state tuition. And I worked for him for 4 years. And I loved it. At that time, I wrote a bill taking what were considered offensive terms out of the state statutes then. They were still, today, those terms would be considered offensive. But, in those days, moron, idiot, and I think lunatic, I don't remember, those were medical terms. And each one was an IQ sector. So we took those out and we took out, I don't know, we may have changed it to something that wasn't, but it was better. So all of that kind of set me up for public health and disabilities. So I joined APHA a long time ago. And when the disability section formed, I wasn't in there when it was the SPIG, but I did get in afterwards. And I got in because I was looking for help with data when I started working on the Hill. So when we were working on some of these bills, and we were advocating after the bills were passed, I needed data. And so I got involved with some folks, Charles Drum, Stephen Kay, Gloria Cron, and there's one other person whose name I don't remember, were very, very helpful with giving me data. And what happened was, I'll never forget this. I was in New York visiting my daughters, and we were in 42nd Street, and my cell phone rang, and it was someone from the government who will remain nameless, who said to me, we don't have it, there's no health disparities for people with disabilities. I know you got it in the bill, but there are no health disparities. And I said, you know what? You get me a meeting with whoever said that, and I'll bring you the data. And so Charles Drum, Gloria Cron, and Stephen Kay, and a whole bunch of other people in the section gave me data. I mean, we literally, I think we set up like a Dropbox or something, and we said, put data in here, whatever you have. If you have an article on data that shows the difference between people with disabilities and people, put it in there. And so we got this meeting, and several folks came with me to the meeting. And I'll never forget, we purposely put it in a big 3-ring binder, a big fat 3-ring binder. It was, and it was before everybody did everything on their, laptop and whatever. And we said, here's the data. And we pushed it down the conference room table. And they agreed that there was, that's fine. So Gloria Cron was assigned with another former member of our section to write an article for the APHA Journal on health disparities, disability as a health disparity population. And they wrote a great article. And see, what I like is I didn't write it, but I advocated for someone to write it. Okay. That's my role. I'm not the scientist. I'm not a big data person, but I understand data and I know what data we need to be able to push policy. So that's how I look at it. My role now, I'm co-chair of external policy for this section. So me, the big thing to know is what data do we need and who's got it? I'm not going to create the data because that's not what I do. But people in the section create the data, and I know what data I need. I know who has it. I know where to get it from, and I know how to use it to argue policy, to support policy.
Which is super important. And so it
absolutely,
yeah, that makes perfect sense why you would get involved. And there are some great connections with people who, like you said, have the data to help support policy changes.
exactly. And I can tell you another story where getting the data from members was crucial. And that was when we were working on the Affordable Care Act. I wanted to get disability in the bill everywhere racial and ethnic appeared. So health disparities, training doctors to treat the populations, all of that stuff, grants, everything. So I went to the group that was doing racial and ethnic stuff. And they would write sign-on letters and they wouldn't put disability in any of the letters. And I have a big mouth and I use it. And I would complain. And so one of the meetings, these two guys came over to me, they were in my face, and I don't remember what they were, it doesn't matter, but they were, racial, ethnic, whatever. And they said to me, why are you here? This is for racial and ethnic groups. And I argued the concept of intersectionality, which wasn't out there yet. And I hadn't, the word term I hadn't heard yet either. And I said, you got a grandmother? And the guy said, yes. And I said, well, your grandmother has a greater chance of being diabetic than my grandmother. And once she's diabetic, she has a greater chance of having an amputation earlier and at a higher level on her leg than my grandmother. And once she gets that amputation, she's going to be in a wheelchair. And you know what happens if she needs to get a mammogram? She may never get one because the mammography facility may not be accessible to a wheelchair user. So she might die of cancer. Don't you care about her? And he basically said, we can care about her in the next bill. So I took my bat and glove and I said, I got to do something. So I contacted disability groups and put together a coalition, got data. That was the best part, is people in the section gave me data so I could show that, you can say, and I'm just making this up, that African Americans die X number of years earlier than Caucasians. I needed that kind of data about people with disabilities, and I got it. People in the section gave me data. And so we wrote sign-on letters where we sent these letters to members of Congress, but they were evidence-based sign-on letters. And it said, and I'm just making this up off the top of my head, that, people with, well, at the time it was probably a factor, but people with intellectual disabilities die 25 years earlier than everybody else. Here's the data that shows that we need to, this is a health disparity population. Here's the data.
Right.
So we got it in the bill. People with disabilities are everywhere racial and ethnic groups appear. So
Mhm.
all the things that they got, we got. And the best thing that happened is after it happened, they kind of said to me, you were right. And this concept of intersectionality is important. And they invited me to the table. They put me on the coalition, the group that runs the coalition for the HEA bill, the Health Equity and Accountability Act.
Okay.
Never passes, but pieces of it get into other bills. And now when we do our briefings, I'm always at the table talking about disability. So, and the other thing is that I kind of laugh at is the LGBTQ groups, they got kicked out too. But once the bill passed, they got invited into the tent as well. And my joke with them is, you have the political power as LGBTQ folks, and you got the money, but we're in the bill, we're in laws already. You're not. We have the ADA, we have some of these other things, the Rehab Act, um, but they had power, and I think that's now we're getting more power. Data is important.
Yeah, absolutely. Absolutely. I mean, that's a pretty big accomplishment that you were able to achieve with the help of the section. I mean, getting all of disability in the bill and getting a seat at the table for future policies. It's pretty incredible.
It
So that's
really is. And I can't thank this section enough because we had representatives from national disability groups, local disability groups, academics, researchers, everybody. And, if I needed something, all I had to do was say, I need data on X. And then in 10 minutes, I would have more than I needed.
that's
So
amazing.
it was really great. This is the best source for data, is the section.
Absolutely. So I would say that's a pretty large accomplishment. But what are some of the other accomplishments that you have seen during your time in the disability section, and also sort of at the same time, what were the major policy issues that you had to address, if there's others beyond what you were just
Well,
sharing?
yeah, I think the big ones were the Affordable Care Act, and there's a section in it for non-discrimination, as well as some of these other sections that we were able to get in to the bill, that we didn't even kind of didn't even think about. And then the redo of the ADA, that was really important as well, and the section played a big role in that too. And when I worked on the Hill, I would see section members coming up to meet with the members and stuff, and that was really, really exciting. And the main thing is that what this has shown me was that you can make a change. What you do is important. And if you're listening to this and you live in the middle of nowhere, talk to your member. If you're in a small town, maybe Friday night fish fry or in church, you can see somebody who is your representative who's home. Talk to them. They don't always know about this stuff. And, if you can find something where you can relate to them, to connect, like the fact that you both go to Friday night fish fry, you're members of the same church, or your mother and his wife are in, the same gardening club or whatever it is, find a commonality where you connect with people.
Mhm.
And you just never know when you can connect that way, you can kind of bring something in. Like, there's a bill coming up, and I do a lot of work with people with disabilities. And I was wondering if I could talk to you about that sometime. And they may say, well, I got Pete in my office handles that. Well, that's fine. If he hands you off to Pete, that's even better. Because if you tell him, he may not remember it, it might be over his head, but Pete may be really important with it. So you never know when you can make these connections. And again, if they ask you for data, go to the section and find somebody who's got the data. I'm not a data expert, and I kind of have to laugh because I get invited to a lot of national meetings about data. And I kind of say to them, well, I know how to use data for policy. That's my expertise. Is you give me the data, I can advocate with it. Do I create data? No, I'm a qualitative researcher. I tell people I don't do numbers. I can talk about numbers, I can sell numbers to members of Congress, but I don't create them. So you just never know. And the section is such an amazing resource for this kind of stuff. You have to ask the right question though, because someone's a researcher and they're dealing with numbers. They may not connect it to policy, but if
Mhm.
you know that you need to show that a lot of people, and I'm using that on purpose because whatever the, what the data shows, that a lot of people would benefit from X in a bill. And they would benefit from it because maybe they're missing a hand or they have intellectual disabilities, whatever it is. You can know that and get that data from someone in the section. Someone in the section has data on just about everything you need, and you connect the dots. Using data is a talent. Creating it's a bigger talent. I use it. People in this, there are other people in the section who create it, and I really admire them, and they share.
Yeah, that sounds like the key piece is being able to, like you said, know what to ask for, what you need to show, and then the fact that everyone is willing to share and help facilitate the process is incredible because they're they're all different skills, and it's like most people don't have all of those skill sets, so we have to work together.
Exactly. And if you do talk to someone at the bowling alley, you talk to your representative at the bowling alley, your member of Congress, and they ask you a question, always say, gee, I don't know that, but I can find that out for you. There's someone in my section, I can get some data for you. So, think about it that way, that before you say no, got to ask somebody. Is there someone within the sphere who can provide that kind of data, if that's what they're asking for?
Absolutely. Now, so the major accomplishments, both with the Affordable Care Act and Americans with Disabilities Act, I'm sure came with lots of challenges. So, what can you tell us a little bit more about some of the challenges that you did and maybe continue to face with getting the disability section involved in policy and advocacy, and or just in general with your advocacy work?
Mhm. Well, lately, over the last 4 years, it's been kind of tough because when a law passes, they pass. It's not just the law. There are regulations and policies that come out under that, and in the last 4 years, a lot of those policies have been reversed and put taken away. So it's kind of been a lot of keeping track of what crisis do we have this week.
Mhm.
So, for example, the Fair Housing Act is one law that is very helpful for people with disabilities, because if you need, for us in occupational therapy, if you do a home assessment and somebody needs a grab bar, the landlord has to let them put in the grab bar by law under the Fair Housing Act, unless the landlord can prove why that you can't do that. Now, why would you not be able to put in a grab bar? Maybe the building's 150 years old, and if you put a grab bar in, nobody knows what's behind the wall. Okay. That's a very remote example, but a possibility. So under what the administration was trying to do is they wanted to shift the burden. Right now, the burden of proof, the landlord has to show why you can't put in the grab bar. The current administration wanted to shift the burden to the person who wants to put the grab bar in to prove why they can put the grab bar in.
Mm.
And when you think about that, that's really burdensome,
Yeah.
because, it should be obvious that I'm a wheelchair user. I just had a stroke. I'm coming home, whatever. I need a grab bar. There's nothing unusual about a grab bar or whatever other kind of, I need to put in, um, you know, a raised toilet seat, whatever it is. So they wanted to change that. Well, that's not good. That's really bad stuff. So there have been a lot of things like that in the last 4 years that they've changed or tried to change to shift the burden to make it harder for people with disabilities to have their rights, even though the law is in place. The ADA didn't go away, and Affordable Care Act hasn't gone away yet, but they've narrowed how they're interpreting it, and they're making you have to prove more. So some of that's going to be a problem, and hopefully we'll be able to put that back eventually when the administration changes, however, whenever that happens. So that's one of the big issues is how do we, what do we do with that? So those kinds of things have changed, and we've been monitoring them as a section. As the representative for external policy, I write letters, I send emails, I post things and tell people, please, 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 here's a sample of a letter you can write. Please send this into your to either HHS or your member or wherever. If they're asking for comments on a rule, send this in. So that's part of what we've been doing. And I have to admit that over the last 4 years, it's been overwhelming, the things that they're trying to change and take away.
Absolutely. Yeah, it's hard to keep up with everything. How do you manage?
Well, I'm on a lot of mailing lists and Facebook groups.
Okay.
But even then, sometimes it's like, wait, when did that happen? you know,
Right.
where'd that go? So some of it's luck, literally, because I've never, I'm kind of old as time goes, and I've never seen a time in my life where so much has been reversed in the disability rights world.
Mhm.
I'm not used to that. I grew up with the disability rights movement, and I'm used to seeing us getting rights, not
Right.
having them taken away.
Absolutely.
So, it's kind of scary. So it'll be a matter of putting them back when we can get things going again.
Absolutely. Speaking of sort of things being removed or taken away, can you tell us a little bit about what would happen if the Supreme Court removes the Affordable Care Act and what that would mean for people with disabilities?
Well, if the Supreme Court reverses, gets rid of the Affordable Care Act, we have a lot of problems. First of all, the law has anti-discrimination provisions, which says that doctors have to treat you. They can't not treat you. Now, you might say, well, the ADA says that too. It's a little different. A doctor can have an excuse for not wanting to treat a person. Doesn't necessarily have to be based on disability. They can have other reasons. But the other problem that's going to happen is that people with disabilities are not going to be like allowed in certain types of facilities. Maybe a nursing home will say, oh, we don't have the capacity to rehab that person, to treat that person. We're just not set up for that. So there might be some, beginning discrimination. Okay, that's one piece. But the other things that go away, right now we're occupational therapists. Occupational therapy, physical therapy, speech therapy is a covered service.
Hmm.
If it goes away, it may not be a covered service anymore. So if you have kids and they're on, little kids on your insurance, forget it. Not going to cover it. The other thing with little kids is before the Affordable Care Act, if you have a child that's got cerebral palsy or intellectual disabilities, these are pre-existing conditions. You're born with cerebral palsy. So before the Affordable Care Act, your child may not have been covered for therapy services, for anything. So imagine having a child with CP who needs OT, PT, and speech, and you can't afford it. And the way it is now, they have to pay for it because there's no pre-existing conditions. But if pre-existing conditions go away, then disabilities that you acquire from birth, etc., or if you switch to another insurance company, they don't have to cover it. So this is kind of scary stuff because
Hmm.
they can say anything's a pre-existing condition, and if you have CP, maybe they're not going to pay for hearing tests, which has absolutely nothing to do with anything. Or if
Right.
you have CP, maybe they're not going to pay for a physical, or maybe they're not going to pay for your cancer treatment because you have a pre-existing condition. So this is very scary stuff. Um, we've been able to do a lot with the Affordable Care Act. The other piece that happens is because of this, a lot of therapists are going to get laid off because they won't be able to treat the people that they've been treating. Private practices may end up closing because it's not covered. And we're going to see a situation where kids who could be helped and, become functional adults may not have that opportunity because their parents can't afford to get the intervention for them. So we may go back to, where you had, what do you do when you have a 15-year-old with CP who's had no therapy? What's their future like? Yeah, they're going through school and maybe the schools are providing, but the schools only provide educationally relevant services. And keep in mind that it was the Affordable Care Act that allowed states to expand Medicaid.
Hmm.
And when they expanded Medicaid, schools began to bill Medicaid for occupational therapy, physical therapy services. So if that goes away, what happens? Are schools going to be able to afford to provide the services they need to provide? Are they going to be able to to find therapists in rural areas to pay them to do this? It's going to be a very difficult situation. And we're going to see things that, kids that just don't get what they need. We're going to see older adults that don't get what they need. And we're going to see, just a, a, a world of people with disabilities who go untreated. and who don't get to improve in their levels of functioning because they can't afford treatment. It's very scary to me. When you
Absolutely.
look at what's covered, there are 10 essential health benefits. Lab services are on there, x-rays, there's a whole bunch. When you think of what are typical, you go to the doctor, let's say you have a stomach ache, you go to the doctor, maybe he orders some medication, he orders some x-rays and maybe a test to see what's going on in your stomach. None of that's going to necessarily be covered anymore. It depends on the plan you're on. And stomach ache, you have something wrong with your eye, that's a pre-existing condition. So maybe we're not going to treat that because you have a pre-existing condition and we don't have to cover you. And when you think about it, the other thing is, so we've had the Affordable Care Act since basically for 10 years now.
Mm-hmm.
So what if you were born after the Affordable Care Act passed and maybe you were preemie? So you've got some, preemie issues. Is that now all a pre-existing condition and you're no longer entitled to therapy anywhere? Schools, no Medicaid's gone. And if it is Medicaid's pre-existing condition, what do we do? It's a very, very scary thought. We fixed a lot of things and all this does is break them again and put people, I'm a parent. I've got 6 kids with disabilities. They're adults, but I worry about them.
Mm-hmm.
What happens if they can't get health insurance? And it's likely that most of them will probably be, unless they can get health insurance on the job, but even on the job they have pre-existing condition clauses.
Right, right,
What happens? I mean, we have a whole society that's been taken care of in a good way. I'm not, we've taken
right,
care of health. We've looked at people and said, how can we make you healthy? How can we improve your life and function? And now we're saying, oh, we made a mistake. We don't care about that. Oh, we gave you glasses. We're not giving you glasses anymore. That's a pre-existing condition. We gave you a splint to fix your hand. We're not going to fix your splint anymore. We're not going to give you new splints. That's a pre-existing condition. We paid for your wheelchair. We're not paying for wheelchairs anymore. That's a pre-existing condition. And it's very scary to me, as a disability advocate, as a person with a disability, as a parent of kids with disabilities. This is very, very scary to me. And to me it's inhumane, but there's a good chance that it may happen, and it's just very scary.
absolutely. And so, what are some of the things that you're doing right now, or that the section could be doing right now to help prevent this?
Well, I think what we're going to end up having to do is a section, because we have no influence on the court, on the
Right.
Supreme Court. Okay, now we can go and, I've been to many protests outside the Supreme Court, I admit it. Not since the pandemic, but before it. It's always fun to go there and watch the both sides of the issue, whatever the issue is. I'm a member of the Supreme Court bar. So I think what we'll end up doing as a section is kind of doing what we did when the Affordable Care Act passed, is putting together a coalition of people, of disability groups, people with disabilities, professionals, researchers, putting that coalition together and seeing how we can best be an influence. So I would think, depending on what happens in this election, if what happens in the Senate, if, different, if the Senate gets more people who want to provide health care, we may see another bill, and we may see a redo of the Affordable Care Act in another format. And if that happens, we will play a very significant role in that as a section. We will be giving our members data. We will be putting together sheets of data of what we need about, this is what people with disabilities need. This is why, this is what it means. This is how it's going to change their lives. This is what happens if they don't have it. And so we will be having, information out and data for people. The other thing that's kind of interesting is, the politics in healthcare. Politics shouldn't be in healthcare. Healthcare is healthcare. Everybody should agree that we don't want people to die from a pandemic. Everybody should agree that we want people to get the healthcare services they need. It's humanity. We're the only country in the world that doesn't provide health services for, in the the high level world of that we're in that doesn't provide services. So that's something that, we're going to have to get out and that our members will be a part of in sharing this. We'll put together the data sheets and sending it out to our members, explaining to them what they should have included in bills. We will probably organize our own sort of Hill Day virtual meetings with members who are on committees and see if we can find the members of our section who have members who are on committees and meet with them and see if we can get some folks to be our cheerleaders on the Hill.
Okay, that makes sense. That's great.
But we have power. We can do something. We as citizens and as educated citizens, we can do something.
Absolutely. And like you said, even if you don't know the answer to something, someone in the section probably does and probably has the data to support, the stance that we need. So it's just
Exactly.
out and collaborating, and making sure that we work together for disability rights. Um, which sort of leads me to my next question about who some of the key players and allies in the kind of field of disability, public health, and policy have been kind of throughout your time in the section, and who
Mm-hmm.
the key players and allies are, or who you think they may be now.
Well, I had a lot of help when I needed data from people like Charles Drum, Gloria Cron, um, Steve Kay, and Willie. What's Willie's last name?
Horner Johnson.
Yeah, Willie Horner Johnson. When I needed data, they gave me data, and it was very, very, very helpful. Um, and they just, I would ask for data, I'd have it the next day or in a couple of hours. I mean, they were very conscious of the need and what we were doing with it, and they were extremely helpful. And understanding perspectives. I'm not, I learned a lot about the the public health surveys and how to use them and how to talk the talk, and they helped me through that, and that was very helpful to be able to talk to members on the Hill and be able to say, well, the NHIS says this, and someone told me that. But I have to admit, I learned a lot about all of the surveys, and I learned how to argue the policy using the surveys, how to support policy with the surveys. And I still do that, and it's extremely helpful. I know what I was talking about in the beginning, but everybody taught me, and it works. People are very impressed with that, and not with me, but with the data,
Right.
and how we use the data and where it comes from and how data supports policy. And that's, I'm always telling them, don't listen to me, listen to the data.
Mm-hmm. Absolutely. Thank you. So, what advice do you have for sort of the future leaders of the disability section and future or current young or early career activists?
Well, I think that one of the most important things that you need to remember is that you can get something done. All right, you have power and you can get something done. And you may think that, I'm just one person, but being just one person, if you can gather other people and get people behind you and organize other people to get done what you want done. You can find people who know more than you to help you with an area you don't know about. That's what I've always done. Because, again, I'm not a data person. I'm more of a data person now than I've ever been, but I wasn't in the beginning. And at one point, I was on a negotiated rulemaking committee for HRSA to look at the criteria for medically underserved populations and health profession shortage areas. And again, I'm not the numbers person, but the section, everybody was so helpful to me. I would ask them questions and say, how can I argue this? Give me some data. And they would give it to me. And, here I was, I'm a qualitative person. I'm arguing data because I knew I knew what my limits were. I knew where I wanted to go. And I knew that in order to get there, I had to ask people who knew more than me about it. And that if I could understand enough to be able to argue what they were saying, and, I am an attorney, so I'm used to arguing, but, it's hard to argue what you don't know. But I
Right.
was able to get enough of an understanding. People were helping me. People were giving me the data, explaining to me, and I got enough confidence to be able to use the data they were giving me. And I think it's important that if you have a goal, you can achieve that goal in policy. You just have to ask for help, organize other people, know your limits, know who knows more than you, and where you can get stuff to argue, and stuff that's more than what you know from people who know more, but stuff that they want to know. When I say stuff, what does that mean? When you go to the Hill, for example, and you can do that, or you can go in your own local office in your own hometown, they want to know something, they want data to prove it. You can give them that data. That's the stuff. And you can say, I saw that Representative, Smith is going, has a hearing next week with the head of the CDC, and we would love if he could ask him about this. You can do that stuff.
Right.
And to have that confidence in yourself, to know that you know a lot of things that your members, your elected representatives don't know. And oftentimes you can get to be friends with people in the office, so that when they have a question that's a data question, for example, or a question about your area, they'll call you, they'll contact you, they'll email you. And when I worked on the Hill, when I first got there, I would say to the person I was working for, what about this? And she would say, oh, you got to call this person. This person's an expert on that. Whenever I have a question about that, I call them, and they always have the answer for me. And you want to be that person. You want to be in that legislative assistant's back pocket, so that when they have a question, they call you. The best thing you can do for someone in on the Hill or in local offices is to be a resource for them, and tell them whenever you have a question about public health and disabilities, or whatever your specific area is, call me. And if I don't know, I will find someone who does, or I will look it up for you.
Right. Absolutely. That's a great point. Um, and also, do you have recommendations for our listeners about what maybe listservs or Twitter handles or Facebook pages or whatever it might be that we should be on the lookout for to help us keep up with some of the policy changes and things that might be important for us to be um, speaking up about?
Well, I would definitely look in our in the sections Twitter. Um, I still tweet for them when there's something. We have several of us. There's someone in charge, and several of us tweet. So I still tweet for them when there's something. And the other thing is, there are, as far as listservs, I'm not familiar with any listservs, but there are some groups that are worth following, like on Instagram. So the American Association on People with Disabilities, AAPD, I would follow them. I would follow some of the other disability groups are good to follow, and you could kind of pick them, UCP, just about all of the ones in the DC Metro, the national ones, will be, putting stuff on Twitter, Facebook, and you can look and see what's going on with them. There are some disability groups that, I mean, the AAPD, if you go to theirs, you'll find a lot from them.
Okay, perfect. Thank you. And those are actually all of my questions today. Do you have any other information or stories you'd like to share with us?
I guess, to me, the most important thing is that you can do this. If there's something, there's something in your head where you say, I've always wondered why this doesn't happen. I want to make this happen. And, that happened to me with the Affordable Care Act, when I said, why should racial and ethnic groups get it, not people with disabilities? And, pushing that concept of intersectionality can also help you. That if you're working with local groups that are working on, the Black Lives Matter movement is a great example. Black people have disabilities too. And people with disabilities experience the same kinds of, being left out, being treated differently as Black people do. But if you're Black and you have a disability, it's 10 times worse. When it's intersectionality, when you look at that, and in some cultures, intersectionality is bad because people with disabilities are looked down on in some cultures. They're not valued. So if you're a member of a certain minority group, cultural group, whatever, plus you have a disability, that may be an added disadvantage. In some cultures, it may be an added advantage because it shows that you have overcome a lot, which sounds a little, putting down and not treating people equally, but I'm talking about cultural differences and the way different
Right.
cultures treat people. This is not my opinion, but it's something we have to consider, is that different cultures treat people differently. But this concept of intersectionality is really, really important, because you can have a disability, you can be African American, and you can be a member of the LGBTQ community all at once.
Right.
And I think that's something that a lot of the movements tend to leave out.
Mhm.
They don't look at the intersectionality, and that's so important,
Mhm.
especially in today's world. And one of the committees I was on when we were doing the Affordable Care Act was the section 1557, which is the anti-discrimination provisions. I represented disabilities, and then we had people representing all of the groups. And that's where we really would kind of start talking about intersectionality, that we all need to be in this anti-discrimination, but we also need to realize that we're all facing discrimination, all the groups, and some are facing more because they're members of one or more groups. And you don't want this group to be discriminate against that group. We're all in this together. And
Right.
I think that's kind of um, the important messaging, is that if you have a disability, fine. If you're LGBTQ, fine. We have to recognize that all of us are in the same boat. There are people that don't like us. There are people that want to leave us out. There are people that don't want to accommodate us. There are people that don't want to include us. And we're all in this together,
Hmm. Absolutely. And we're stronger together.
much stronger together. And our section has done some amazing things. Um, and if you have a good idea and you want to do something with policy, I'm happy to help you and mentor you into doing that. The people mentored me, and I want to return that.
Excellent. Thank you. So, so would it be okay then if I left or if I included some kind of contact information for listeners that are interested to reach out?
Sure,
Okay, great.
sure.
How about that? Well, thank you so much for coming on today. We really appreciate your insight and sharing your experiences in the disability section and advocating for disability rights. And please keep it up.
I will. Thank you.
Thank you.